Hello guys, welcome back to my channel. If you're new here, my name is Edwin, and in today's video, as you can see, I'm dressed in my dental clinic coat here, and as part of the week, which is August the 3rd to August the 10th, which is a special week because it's Australian Dental Association's Dental Awareness Week. So as part of this week, the goal is to try and make the broader community understand ways to improve their oral hygiene routine to better address oral health outcomes. So our overall health is advocated from the day we were born as children in school, and as adults we're told to eat healthy, exercise, sleep well. But dental hygiene has improved over the years. We're told to brush twice a day. Pretty much everyone knows to brush twice a day. But the education revolving around dental hygiene has still a long way to go. Now, why is dental hygiene and dental health so important? Well, dental health, as many people do not know, is related to your overall health. So if you have many dental infections, this can translate to greater problems with your immune system and make you prone to diseases such as diabetes, high blood pressure. All of these systemic diseases that is present in modern society is also linked to oral hygiene. So having good oral hygiene not only means that you're going to have a confident smile, you're going to have good aesthetics, but you're also more likely to have good systemic health. So today we will try and go over a few tips and tricks that you may have or may not have heard, and hopefully it's helpful for you to improve your oral hygiene. So for tip number one, what I have here is a model and a toothbrush. So brushing teeth, everyone knows that it's important because brushing teeth, we remove bacteria from the mouth, and bacteria can cause common diseases such as caries. So, however, another major outcome or purpose of brushing teeth is to remove bacteria from the gum line. Now, our gums is like a pocket, okay? So if I had sleeves, which I don't have long sleeves here, but if I had long sleeves, right, my tooth would be like my fist, and the sleeves would leave a gap between the tooth or my hand and create sort of something like a pocket. Now this pocket, right, which is around the gum line here, is a very, very good area for bacteria to accumulate. And over time, if this bacteria is not removed through, let's say, flossing or proper brushing technique, this could cause something called gingivitis or inflamed gums. And inflamed gums you will encounter, pretty much everyone would encounter, because it's bacteria will always accumulate in those areas, and inflammation is a normal process. However, our goal is to not let that inflammation become chronic and long term, which can lead to another disease that some people may not have heard of, which is called periodontal disease, where the bacteria starts destroying bone surrounding the teeth. And the loss of bone is, as you can guess, irreplaceable. So our brushing technique is important because a lot of people like to go through this scraping motion, right? This scraping motion here. Now the problem with this scraping motion is that not only does it make it hard to get inside the gum line, it also can cause damage to the gum line. So our gums aren't like our teeth, which are hard tissues, right? The teeth is the hardest organ or substance in the body. But our gums are soft tissues. And over time, if you use really hard pressure, you can cause permanent damage to these gum lines and cause them to recede. And just like a receding hairline, receding gum lines aren't great. So, recommendation is to always brush at a 45-degree angle to the gum line. Okay? Or to the vertical, should I say. And this allows the bristles of the toothbrush to enter the gum line and to allow the bristles to clean out areas where bacteria can accumulate. Now, another component of brushing correctly is to try and use a soft bristled toothbrush. Hard bristles can again cause damage to our gums. So soft bristles, although you might think, wouldn't hard bristles get rid of bacteria more? The answer is, if you use the right technique, soft bristles should do as good as a job as harder bristles do. Now, if you're like me and prefer to use an electronic toothbrush, an electronic toothbrush is also a great way to remove plaque, because the electronic toothbrush sort of does the circular motion that we aim for when we hit the gum line for you. So all you need to do is really angle the toothbrush and put it where areas you need to clean. So electronic toothbrush is definitely a recommended, and some studies have shown that electronic toothbrushes do a better job than manual toothbrushes. Okay, so that is all about toothbrushing, but also additionally, on top of the correct toothbrushing technique, always aim to use fluoridated toothpaste. Most toothpaste you find in supermarket will be fluoridated, but you can check in the ingredients, because fluoride adds strength to our teeth and prevents it from bacteria acid attacks, or sort of minimizes the impacts of bacteria acid attacks. So, the next tip we're going to talk about is avoiding acidic foods and drinks. So, not completely avoid. So, there are many things in our diet that is acidic. In fact, pretty much everyone will be having acidic foods, fruits, drinks on a daily basis. But for those of you who love to drink Coke or soda or any sport drinks, those beverages are very, very acidic. So, the pH is less than 3. So what happens if you excessively drink these on a frequent basis is that it can erode or basically disintegrate your teeth. So teeth is made out of a material that starts to dissolve at around pH 5.5. Now with toothbrushing and adding fluoride to our teeth, this pH can be dropped to 4.5. But if you drink acidic drinks, even fluoride cannot help, because if you drink, let's say, Coca-Cola, which has a pH of around 2.3, the moment it touches the teeth, right, it will start to disintegrate the teeth. So if you've never seen those videos where people leave a tooth in Coca-Cola for a day or 2 days, over that time, the tooth will completely disappear because it's so acidic. And the process is called erosion, and erosion, again, is an irreversible process. So if you're drinking Coca-Cola, aim to drink through a straw, which can reduce the damage or the spread of the acid. Do not swish the Coca-Cola or drink in your mouth. And again, drink water and other neutral pH substances after consuming those foods. But I'm not saying that, avoid oranges, avoid orange juice. They are healthy for the body, but consume in moderate amounts. Okay, so that's the process of erosion. Okay, so for our third tip, we're going to talk about flossing. No, not that type of flossing, but using this wax floss to remove plaque between the gingival lines. So, flossing is not a habit that a lot of people like to do. And the reason for that is flossing can be very, very annoying and irritating, and you might see bleeding gums. It also takes a while, and some people just aren't bothered or don't have the time to floss. Now, but again, I want to reiterate the importance of flossing, because flossing removes bacteria and plaque from those gum lines. And as I said before, if those plaque or bacteria is not removed from our gum lines, it can eventually cause periodontal disease and the loss of teeth. So with flossing, if you don't like to use a traditional flosser, you can use a water flosser, which has become popular in recent years. They all seem to do a fairly good job. But in the next segment, we'll show you the correct way to floss. And hopefully through getting into a habit, maybe on once a week basis, maybe twice a week, and then increasing the frequency, flossing can become a daily or routine habit for you. What we have here is a demonstration of good flossing technique. So very simple. We grab a small portion of the floss, wrap it around both your fingers, and we pass that floss down between the contacts of the teeth, and then we go in an up and down motion to scrape against the teeth and the gums. And after doing that, you can pop it out. Again, for another demonstration, we can do that again. So let's get that focus. So we put the the floss between two teeth, right, and floss it against the teeth inside the gum line. So it's a bit hard to do it on this model here. It's easier on a real human, I would say, but just going up and down. You can go sideways as well, and after that, if you've got plaque, it would catch some of that on this floss and use a different part for the next teeth. So because we don't want to bring the bacteria from one side of the teeth to another portion or area of the mouth. So that is the correct flossing technique. Again, for some people, they might like to use fancy technology, like we can use water flosses and stuff like that. They will also do the job if you use them correctly. But a traditional floss, if you don't want to spend, a few $100s on dental technologies, will do the job. So try and get into the flossing habit. So advice number 4 is that we need to understand the importance saliva plays within our oral hygiene and oral health. Saliva is a really, really critical component that is often overlooked. So how does saliva help? Well, number 1, it has the raw ingredients to help replenish our teeth, which is calcium and phosphates. And number 2 is they have a buffering capacity, which means that when acid comes into the mouth, whether that be through diet or through bacterial origins, they can help to reduce those impacts of those acids onto our teeth. So saliva is something that everyone has, but having good quantity and quality of saliva is also important. As people age, the quality and quantity of saliva will degrade because either cells aren't functioning as well, people become more dehydrated, or they're on medications or chemotherapy of some sort that can cause the impacts on saliva content. So as individuals, what we should try and do is always be hydrated. By having enough fluids, right, we won't have dry mouth. And without dry mouth, we become less at risk to diseases such as dental caries. And number 2 is you can always chew gum. So chewing gum has had a lot of scientific research done on it because chewing gum stimulates saliva flow. And by having more saliva, we become less at risk for some diseases, again, like caries. And also reduces the impacts of acids in our diet. So always stay hydrated. Try and carry some chewing gum around with you because stimulating that saliva flow will mean that you will be less prone to certain dental illnesses. Tip number 5 and advice number 5 is visit your dentist hopefully at least twice a year, if not once a year minimum. Now, why is it important to visit the dentist even though you might not have pain? So a lot of people stick on the old idea of you only fix a problem when it arises. Now that idea and concept should not be applied to oral health. The reason for that is many oral health diseases arise gradually throughout time. You don't get it one day. It's a process of either not having good oral hygiene or having poor saliva or eating sugary and acidic foods. These develop over a period of time, and usually a disease wouldn't have major impacts overnight. So by seeing your dentist on a biannually basis, your dentist can pick up those diseases early and use less invasive treatments when possible to preserve as much tooth structure or if you have nothing at all, we can use preventative measures like get rid of plaque and calculus, which sometimes can be difficult to remove. So seeing your dentist on a biannual basis will save you in the long run because you might be avoiding those more expensive treatments because you've left it too long. But also it can prevent those diseases from further progression using minimal intervention methods like remineralizing tooth structure. And that is basically it. So those are the 5 tips I just wanted to reiterate to you guys. If you don't understand any of these, feel free to leave a comment in the comment section, and I'll try and clarify a few things. But hopefully you've learned something, and hopefully you can understand that oral health is a really, really important component of your life. And I hope every one of you stays healthy during this time. Alright, thank you for watching. Please click the like button and the subscribe button. I'll see you guys in the next video. Peace.